And so, long story short, essentially, these pieces together have really made me who I am, what I like to think of as an advocate for both the patient as a human being, a person with unique features experiencing, oftentimes the most difficult, vulnerable thing in their life, and their family members experiencing that with them. And yet at the same time, this clinician that's trying to hold, maybe they're holding sleep deprivation or being double or triple booked, or, working 80 or 90 hours a week, maybe facing their own physical or mental health challenges,
Right.
right? All this put together in a system of how in the world can we make medical care a place where two people are meeting together, two human beings, right? And that there can be connection and compassion and good care being given. So, anyway, that's a lot there, I know, but that's really what has kind of led me to the work that I do now.
I mean, this is why I'm so excited to have you on this podcast, because these are things that I think about all the time. I think about, just like you said, two humans coming together, right? So you've got a medical provider or clinician, and you've got a person who is oftentimes in the scariest, most vulnerable place they've ever been in their lives. And this feeling of not having control, right? Like it's there, it's so layered, right? What it's like to get a diagnosis, or to have an unexpected health crisis. And so, yeah, I think a lot about that human aspect. And one of the things that you often talk about, like publicly, is about the system, like you said, and the system that is keeping people up for 100 hours. Like that's forgetting that you're a human. It's almost like this expectation that you're superhuman. And I think about when somebody hasn't had sleep and they haven't had rest and they haven't had a chance to regulate their nervous system. Nobody who's been awake 100 hours is able to like come in with a calm, regulated nervous system and attune to a patient.
There's some data to really back that up. Dr.
Mhm.
Matthew Walker, who wrote the book Why We Sleep, he has a PhD. He's one of the top sleep researchers. He and his team did a study that looked at MRI scans of a person's brain, essentially after a night of no sleep, and they found that what they described as the empathy areas of the brain had significant less function when a person had been sleep deprived, right? And we know this, that people on when we do daylight savings time and you have to, jump forward, spring forward, so to speak. So the whole country is an hour less without sleep. Philanthropic donations go down significantly. We know that when a doctor is low on sleep, they've actually done a study that they feel less compassion for a person's pain, and they're less likely to actually prescribe pain medicine. So there truly is a link here between sleep deprivation and compassion. And I think that if we ignore that, if we continue in the current medical system, which truly allows doctors to train and practice sometimes on very, very little sleep, then in another way, we're setting patients up to possibly find themselves in a healthcare system in which the clinicians around them are barely surviving, just trying to do their best. They may not recognize it, but they may have a physiologic depletion of
Yeah.
empathy. And that significantly can impact a person.
Absolutely. I've talked to hundreds of people about their medical trauma stories. And, you know, oftentimes that's a piece of it, right? Is somebody who didn't have the bandwidth to show up with the empathy and the compassion. And something that's always like stood out to me as people share their stories, a lot of times that's the part they're sharing that has impacted them just as much, if not more, than the medical thing that happened. It's how the humans that they're engaging with are treating them, listening to them, believing them. And when you talked about the empathy and the pain relief, that is something that comes up often, is people not being believed about their pain.